Next in the story, next in this talk on Lassa Fever, I want to talk about Dr. Aniru Conteh, a Sierra Leonean doctor who for 25 years was at the forefront of the fight against Lassa Fever. The story of Aniru Conteh should be told. This is a eulogy written by people who knew him and who worked with him. In memoriam, Aniru Conteh, 1942 to 2004, on the front lines of Lassa Fever. It's written by Daniel G. Bush of Tulane School of Public Health and Tropical Medicine, New Orleans, Louisiana, USA, and Sani Xs Sese of Kenema Government Hospital, Kenema, Sierra Leone, and Babafemi Ocean of Merlin, Sierra Leone, Freetown, Sierra Leone. And then there was a contribution from a Simon Mandel. So, in memoriam, Aniru Conteh, 1942 to 2004, on the front lines of Lassa Fever. Aniru Conteh spent 25 years in his native Sierra Leone, dedicated to treating patients with Lassa Fever, a rodent-borne viral disease to which he ultimately succumbed on April 4, 2004. Dr. Conteh's life is a model of the dedicated healthcare worker. His colleagues hope that his death can galvanize support for healthcare workers and scientists working on the front lines with Lassa fever virus and other emerging pathogens. The son of the local chief, Aniru Sahib Conteh, was born in the small village of Jawi Fulu in Eastern Province, Sierra Leone in 1942. When Conteh was 16 years of age, his mother died, and he left school to help support the family in the capital, Freetown. He eventually returned to school, where he studied chemistry and biology, and earned his bachelor's degree from Durham University, Freetown. After working briefly as a teacher, he enrolled in medical school at the University of Ibadan, Nigeria. He graduated in 1974 and stayed on to work at Ibadan Teaching Hospital. In 1979, Dr. Conteh returned to Sierra Leone, beginning what would be a 25-year career dedicated principally to the fight against Lassa fever. Lassa fever was first recognized in 1969 after 3 nurses working at a mission hospital in northeastern states, Nigeria, came down with a mysterious illness. A new virus was subsequently isolated from a blood specimen sent to the Yale Arbovirus Research Unit and named Lassa after the village of origin of the first case patient. A larger outbreak, 28 cases with at least 14 deaths, occurred in the same region in 1970. Lassa fever first emerged in Sierra Leone in 1972 in a series of nosocomial outbreaks. Nosocomia, that is hospital-associated transmission of infections. The outbreaks were related to patients that were in the hospital, patients and staff in the hospital. The eulogy continued. The disease was found to be common in the community as well, constituting a major cause of illness and death in eastern Sierra Leone, which prompted the Centers for Disease Control to establish the Lassa Fever Research and Control Program in Sierra Leone in 1976. This was published in CDC, U.S. Center for Disease Control and Prevention, emerging infectious diseases. So the eulogy continued. Dr. Conteh willingly plunged into this hotbed of Lassa fever in 1979 when he took a job at Nissen Methodist Hospital in the eastern town of Sewema, the central hospital of CDC's program. He served as the clinical director of the Lassa fever treatment ward and was named Nissen's hospital medical superintendent in 1980. When civil war broke out in 1991, the treatment ward was moved to the relative safety of nearby Kanema Government Hospital, and Dr. Conteh continued as its director. The war eventually forced the CDC program to close, but Dr. Conteh and the Lassa fever wards carried on through the support of the British Medical Relief Agency, MELIN. From 1979 to 2004, Dr. Conteh treated thousands of patients with Lassa fever, becoming the unparalleled world expert on the management of the disease, as well as contributing to research on the subject. He persevered despite many risks. Outbreak of Lassa fever, rebel invasions, and government counter-attacks. Through various projects and experts, war and peace, and waves of refugees, Dr. Conteh continued to treat patients in his characteristically calm and modest manner. His dedication, skill, and courage were some of the few constants in the unstable and often dangerous world around him. In March 2004, Dr. Conteh admitted a young pregnant woman to the Lassa ward with a presumptive diagnosis of severe Lassa fever. The patient was a volunteer nurse on the hospital's pediatric service. On March 17, after numerous unsuccessful attempts by staff members to obtain blood from the patient's arm, Dr. Conteh attempted femoral venipuncture and sustained a needlestick injury in the process. The patient died the next day. On March 23rd, fever developed in Dr. Conteh. Despite the administration of intravenous ribavirin, profuse bleeding and diarrhea developed a few days later. This led to hypovolemic shock and cardiac arrest, which necessitated resuscitation. Bleeding and renal failure ensued. Consultations were sought and received from medical experts around the world. The diagnosis of Lassa fever was confirmed from specimens sent to the National Institute for Communicable Diseases in South Africa. On April 4, in the cruelest irony, Aniru Conteh died of a virus that he had been combating as a physician for most of his life. A patient in a ward that he had been instrumental in establishing and maintaining. This eulogy continues. Dr. Conteh's death represents more than a personal loss. His absence severely undermines the ability to combat Lassa fever, which remains a serious threat. Research over the years has shown that Lassa fever is endemic in Liberia and Guinea as well. The Lassa virus is now believed to infect tens of thousands of people and cause thousands of deaths yearly across West Africa. What lessons, what response can we have to this tragedy? We have made progress in our global response to emerging pathogens, but many challenges remain. Perhaps the most important response is to offer a sound base of support for combating emerging diseases. Where they start, emerging diseases, where they start. relying less on the rapid influx of international experts and the long-distance shipping of specimens, and more on homegrown talent, equipped with the tools and training that they need. Achieving these goals will be difficult. Beyond supplying medicine and laboratory equipment, tackling a problem will require addressing such complex issues as low salaries and brain drain, civil unrest, corruption, and human rights. Dr. Conteh was exceptional because he persisted in the face of these challenges. But we cannot routinely depend on such heroes. Governments in developing countries with international support need to build the base to create stable jobs and training opportunities, adequate physical infrastructure, and safe working environments to foster the development of local expertise and encourage local physicians and scientists to help fill the role vacated by Dr. Conteh. Ultimately, containing emerging diseases depend on the Aniru Contehs of the world. The more support we provide to people on the front lines, the healthier and safer we all will be. Aniru Conteh is survived by his wife Sarah, three sons and 2 daughters. Powerful story of Aniru Conteh, a doctor who spent more than 25 years of his life battling Lassa Fever, and in the end, pregnant patient who was volunteering in one of the wards was admitted suspected of Lassa Fever. Efforts to collect samples from her failed, and he tried femoral tap, and incidentally he got a needlestick injury. He had needle prick and he was infected and subsequently died. What a hero. One point I want to raise from here is this point raised in this eulogy: homegrown talent. Lassa fever was first discovered in patients in hospital staff in Nigeria and West Africa. It has been with us all these years, year by year, killing thousands, killing health workers, killing others. Is it not time that we are able to develop our own technology in order to battle this kind of disease? The monies that people spend in buying private jets, people in public office spend private jets and private luxuries and all that in seeking treatment abroad. Those money could have been invested in having an institution, homegrown institution, that can tackle this kind of diseases, that can develop homegrown solutions, and not just waiting to rely on medicines and vaccines that are sent from far away. This was shown during COVID-19, when international travel was disrupted and people couldn't fly abroad for treatment, and countries had to rely on what they have in country. It exposed us, made us see where we are lacking, and it made some to make statements on how things will be different going forward. But since COVID has moved from acute phase, acute pandemic, and has now become more of an endemic disease, people have moved on. Leaders have moved on. not having enough ventilators, not having enough trained personnel, not having homegrown equipment, and also having homegrown vaccine and all that. All those things have been forgotten. Healthcare workers in the front lines, like Dr. Aniru Conteh, keep bearing the brunt of the collective failure of leadership in Nigeria, in West Africa, and in developing countries, where people have to rely on the Aniru Contehs of the world, have to rely on the Abel or Beta, and rely on others, Peter Idowu, Dr. Esa Oga, Dr. Philip, and others, Dr. Salome Oboyi, rely on heroes who put their all in the fight against these diseases. We just hope that Nigeria now is currently bedeviled with a lot of problems, with insecurity and all of that. We just hope that there will be appropriate attention will be paid to this, that homegrown solutions can be brought to play and sustained, and that healthcare workers, those who are battling illness, battling diseases at the front lines, they are protected, and that we have more facilities and more ways of quickly detecting these illnesses, these diseases, and having homegrown solutions when those diseases are discovered. It's important to note this, that if we, according to this article, ultimately containing, let me start from here. Countries in developing governments in developing countries with international support need to build the base to create stable job and training opportunities, adequate physical infrastructure, and safe working environments to foster the development of local expertise and encourage local physicians and scientists to fill the role vacated by Dr. Conteh. Ultimately, containing emerging diseases depend on the Aniru Contehs of the world. Then, importantly, this article ends with, the more support we provide to people on the front lines, the healthier and safer we all will be. I'll take that again. The more support we provide to people on the front lines, the healthier and safer we all will be. If you provide more support to doctors, healthcare workers, and others fighting in the front lines, we provide more support for them, and they are able to stay healthy and well to do the work, then the healthier and safer we all will be. But if you don't do that, if we keep just stockpiling money that will take care of just our own immediate family and friends and cohorts, and keep depriving the country of resources needed to provide this support, resources needed to develop homegrown solutions to these problems. We keep doing that, we'll keep having situations whereby we lose our bright and dedicated and hardworking doctors and healthcare workers, lose them to this disease. And we have situations where we have more brain drain, where more and more doctors who are coming up from training would decide not to work in Nigeria, rather decide to go out of the country to work. And that brain drain and that depletion of human resource will not help in combating these diseases. So again, the more support we provide to people on the front lines, the healthier and safer we all will be.